really encourage people who are going to explore the finasteride route to think of this as a long-term project and to really ratchet up slowly, if at all, starting initially with a low dose taken for a long period of time, maybe even as long as 25 weeks before considering going up any further. Certainly, as I mentioned before, if you need to go down further, that's not going to be a problem, at least not in terms of reducing side effects. I mean, you're not going to get additional hair growth, but you're certainly not going to increase your side effects if you reduce your dose. However, I will talk a little bit later about post-finasteride syndrome, which is something that's getting increasing attention nowadays. That's something that occurs after people have taken finasteride for an extended period of time. Now, some of you have perhaps heard, and I'll just tell you right here, that the topical forms of finasteride are associated with far less side effects. Now, that might come as surprising, given that topical application of finasteride can lead to systemic distribution of finasteride. But the numbers that are out there right now, it's that topical finasteride is associated with 30 to 50% fewer side effects, or 30 to 50% less severe side effects than oral finasteride. Now, there are several things probably responsible for that. One is that people tend to ratchet up their dose of oral finasteride pretty quickly. But keep in mind that the effective dose of finasteride in the blood is 0.2 milligrams. Now, earlier I said the typical topical finasteride solutions are 0.25%. People are taking 1 mil of it. That equates to 2.5 milligrams. And so it seems like a massive overdosing. But here's the discrepancy, and here's where we can arrive at some reasonable recommendations. If you decide that finasteride is right for you, you get a prescription, I would hope that you're monitoring your DHT levels and other hormone levels. That would be ideal. And working with a doctor, please. 0.5 milligrams to 1 milligram per day of oral finasteride seems to be the best starting place. For topical finasteride, it's going to be that 1 milliliter of 0.25% that we talked about earlier, but that's taken only one time per week. And you can fully expect that right after the application, you will have higher levels of finasteride in your bloodstream and therefore lower levels of DHT, and that will alter across the week. Most people are not going to be able to measure their DHT on a day-by-day or even weekly basis. It's just too expensive and labor-intensive. But I think those dosing regimens ought to get people into more or less the same category of optimizing hair maintenance and hair growth while minimizing finasteride side effects. One point about finasteride taken either alone or in combination is that in recent years, really in the last 5 or so years, there's been increasing discussion about so-called post-finasteride syndrome.